So committee, we're going to begin with SB 45. And Jenna, would you give us a bill brief?
Good morning, Madam Chair, members of the committee. Senate Bill 45 amends KSA 38, 2001. You'll notice a couple of technical updates, but other than that, the most important update is the current law provides that from the years 2010 and on, the current household eligibility for CHIP, which is we know as the Children's Health Insurance Program, is capped at 250% of the federal poverty level from 2008. And I looked up the numbers, and the current federal poverty level in 2008 for a family of 4 was $21,200. And so if my math is correct, that would be about $53,000. And the current federal poverty level in 2023 for a family of 4 is $30,000. And if I multiply that by 2.5, you end up with about $75,000. And the other change it would this would be paragraph 8, it eliminates the 8-month waiting period after your income hits that threshold before an individual would be able to apply for health insurance for their child through CHIP. And I'll be happy to answer any questions.
Any quick questions for Jenna to committee? Seeing none, thank you, Jenna. And we will start with our first proponent, Sarah Furtick, from the Medicaid Director from KDHE. Forgive my voice, up till 1 o'clock this morning talking Chiefs, but you know how that goes.
Thank you, Madam Chair. I think all of us are maybe a little tired this morning. It was a very exciting evening, lots of fireworks in my neighborhood. Good morning, committee. My name is Sarah Furtig. I am the Medicaid Director for the state of Kansas. I work for KDHE, and I'll keep my testimony very brief. KDHE stands in support of Senate Bill 45. In our view, this would correct a long overdue section of the CHIP eligibility statute that is now obsolete and essentially unenforceable. We would support clarifying that CHIP eligibility remains at 250% of the current year's federal poverty level for the very simple reason that it's kind of administratively cumbersome for families and for the state to constantly have to translate the 2008 federal poverty levels into current year numbers. So we feel like that clarification would be much needed. We are also already implementing that policy. You may recall last year there was a budget proviso that authorized the state for this fiscal year only to adopt that policy. We did. So if SB 45 passed, we would anticipate no additional fiscal impact because we've already adopted this policy. And it would also update the outdated statutory language that's unenforceable regarding the waiting period. So, Madam Chair, we stand in support of this bill. We think it's a long overdue statutory update, and we hope the committee will support it. And I'd be happy to stand for any questions.
We'll wait until the end. Thank you, Sarah. And our other proponent is Heather Brom, and Heather's the Health Policy Advisor for Kansas Action for Children. Thank you, Heather.
Thank you, Madam Chair. Again, I'm the Health Policy Advisor with Kansas Action Children. Thank you for the opportunity to provide testimony in support of Senate Bill 45 regarding an almost 15-year error in statute with CHIP. Kids' health depends on regular access to quality care, which includes health insurance coverage. Through CanCare, the Medicaid and CHIP options work together to provide free or low-cost health coverage for kids, covering important time-sensitive services like doctor and dentist visits, immunizations, therapies, prescriptions, and hospital stays. These programs are a lifeline for Kansas families who aren't offered or can't afford health insurance on their own for their children. These programs are designed to work together to meet children's healthcare needs and ensure that no one is left behind. You've already heard information about this bill, but according to state law, Kansas kids can qualify for CHIP if their family's income is less than 250% of the 2008 federal poverty income guidelines. You can find a chart of the erosion that's been going on because of that. In my written testimony, you can see from 2013, it was at 245% with the conversion, and it's down to 225% by 2021. Also in my written testimony, you can see the explanations for why we call this an error. Last year, a budget proviso was included in the budget, temporarily ignoring this 2008 year reference. Over 500 Kansas kids were estimated to benefit from this change based on a fiscal note to last year's bill, Senate Bill 407. But the fix is only good through the end of fiscal year 2023. The legislature must pass legislation to permanently fix this issue. CHIP has connected thousands of Kansas kids to insurance coverage over the last 25 years. We urge your support to pass Senate Bill 45, guaranteeing more Kansas kids continue to have insurance coverage in our state. Thank you, and I'll stand for questions at the appropriate time.
Committee, we have time for 3 questions. Are there any questions? Yes, Senator Petty.
This can either go to you, Heather, or to Sarah. Probably Sarah. Sarah, is there any place else that you deal with that has in legislation has a specific tie to a year that's not current?
Madam Chair, not that I'm aware of in the Medicaid realm. This is the only area where we have that.
Okay, thank you.
Senator Thompson.
Thank you, Madam Chair. Sarah, if somebody gets their insurance through an employer, does that disqualify them for CHIP? I'm just curious.
Yeah, so Madam Chair, the CHIP program is only available for kids who have no other insurance coverage.
Okay.
So if one of their parents became employed and had a family plan that covered the kiddo, they would be ineligible for the CHIP program. This is for kids without insurance.
Got it. Thank you. Thank you, Madam Chair.
Thank you, Sarah. Thank you. This closes our hearing on Senate Bill 45. We will move to Senate Bill 6. As I mentioned, we have lots of testimony. Again, 2 minutes, please, and please don't be offended when you hear the alarm go off, and please try to stay within your 2 minutes. So we're going to begin with Senator Mark Steffen. I'm sorry. We will have an explanation of the bill. Again, trying to hurry. Explanation of the bill from Jenna. Thank you, Jenna.
Thank you, Madam Chair, members of the committee. Senate Bill 6 amends several sections related to the powers of the Secretary of Health, Environment, and local health officers. We'll begin with Section 1. It amends KSA 65-101 by adding a new subsection C, and that new subsection C would clarify that the Secretary of KDHE shall not carry out the provisions of subsections A and B in a way that conflicts with any other statute or expands the authority of the Secretary, and those subsections A and B are, exercise the general supervision for the health of the people of the state of Kansas, and adopt rules and regulations related to carrying out that charge in subsection A related to general supervision of the health of the state of Kansas. Subsection 2 amends KSA 65-116G, and this current law makes it a crime to violate the provisions of this act or the rules and regulations of this act related to enforcement or regulations if you are regulations of an institution if you're a patient of that institution. And the change to this section of law would update the criminal language to comply with current modern drafting practices for criminal language, as well as specify that this criminal penalty shall be related to violating the Act's provisions related to tuberculosis, and clarify that a violation of this Act would be a Class C non-person misdemeanor, which is the lowest level criminal penalty. There you go, and that's subsection 2, section 2, excuse me, I'm trying to go fast. Subsection 3 amends KSA 65-118, and that would eliminate the persons who are required to report certain infectious or contagious diseases. It would eliminate teachers and school administrators from being required to report those infectious or contagious disease cases when they discover them. Section 4 amends KSA 65-119, and that relates to the authorities of local or county boards of health, and it would strike the language related to prohibiting public gatherings so that the county or joint board of health or local health officer would not be able to prohibit gatherings to control infectious or contagious disease spread. Section 5 amends KSA 65-128, and this would require the Secretary of KDHE to send a report to the Legislature, the Speaker of the House, and Representatives related to recommendations to control the spread of infectious and contagious diseases. And it would also eliminate the Secretary of Health and Environment's authority to adopt rules and regulations, and instead change them to recommend recommendations to protect the health and dissemination of diseases injurious to the public, and also make recommendations instead of adopting rules and regulations to control the spread of infectious or contagious diseases. Section 6 amends KSA 65-129B, and this would eliminate the authority of any sheriff, deputy sheriff, or other law enforcement officer of the state to assist in the execution of isolation and quarantine orders. Section 7 would amends KSA 65-129D, and it eliminates it being a crime or unlawful for a public or private agency to discharge an employee solely because that employee is following a recommendation of quarantine. And this would just say that the private or public employer shall not fire a person because they are following those orders, and it would make it instead a civil action where the employee would be able to pursue a civil action against that employer if they were to be fired for that. Section 8 amends KSA 65-202, and that relates to the authority of local health officers, and it makes some technical updates as well as striking, this would be on page 6, lines 38 and 39, the Secretary of Health and Environment from being required to use all known and medically reasonable measures to prevent the spread of the infectious or contagious diseases. And Section 9 amends KSA 72-5180, and this is related to school districts and Board of Education requirements. And this would, if you'll see the changes on page 9, and it would eliminate the reference to the Secretary of Health and Environment in the declaration of state of disaster emergency, and also eliminates the old effective date. And with that, I'll be happy to answer any questions.
Committee, do we have any quick questions for Jenna? Yes, Senator Petty.
Thank you, Jenna, for going over there's a lot. I'm back on page 2, where it refers to that the Secretary of Health and Environment shall not carry out the provisions of subsection A or B. Now, does that mean none of that? Or it also says in the manner that conflicts with any other statute or otherwise it expands authority? So now I'm not sure I quite understand that.
Okay,
I'm not sure what
I
in the
100%.
manner that conflicts with any other statute or otherwise expands the authority of the Secretary. I'm not sure how that impacts Section A.
All right, so it would, my interpretation of this language would be that if the secretary were to try and carry out a provision of law and it would conflict with another law that has been adopted saying you cannot close a gathering related to execution of public health and safety. So it would just prohibit carrying out these provisions in a way that would be contradictory to other state law.
So the Secretary of Health and Environment can carry out the responsibilities under law, but can, if there's some other law out there that,
State statute.
if there's a statute, I'm sorry, that would conflict, then they can't, then she or he cannot.
Correct. Yeah, the secretary could not violate existing law in order to carry out the secretary's duties under subsection A and B.
And then on page 4, it's concerning who does adopt any rules and regulations. If the secretary can't adopt,
Which section are you in?
I just made a note at the bottom of 4. It has to do with, I think it has to do with section 5, or maybe 4. I'm curious as to who does adopt the rules and regulations. The secretary does not?
Right, so if we're speaking about section 5, the secretary would no longer have the authority to adopt rules and regulations to designate the diseases that are infectious or contagious in nature, and instead would submit a report to the Speaker of the House of Representatives and the President of the Senate. And so then the implication would be that the legislature would have to adopt that list of infectious or contagious diseases.
So it would have to be legislated?
If this were to pass That's my
If this
interpretation,
would,
yes.
okay, thank you.
Thank you.
Senator O'Shea.
Thank you, Madam Chair. Can you might need to look this up, but when was this statute last edited, or when was it first put into place? Like, what is the context? How long ago?
So there's several statutes in here, so it would depend on the statutes. If it relates, I mean, I'll have to look that up for some of them, but some of them have been very recent. One way to tell is the ones that say KSA 2022 SUP, so the 65-101, 202, and 72-5180 would have been just in the last couple years. So if there's a specific statute, I'll be happy to look that up for you. Otherwise, I don't know all of them off the top of my head.
Thank you. Thank you, Jenna. I also want to mention, going back to Senate Bill 45, that there are 6 proponent written testimonies that you may want to look at before we work that bill. Going back now, we're going to begin with our proponent testimony, and we'll start with Senator Mark Steffen.
Thank you very much. And with that, I'm going to yield my 2 minutes to Mr. Brian Anderson, hospital CEO, healthcare clinic CEO. And he's on the list, and with his 2 minutes, that would be 4 minutes. And again, in short, what this bill does is converts an inept public health to from an inept dictatorship to a educate and recommend status, which is appropriate. This is a freedom issue. But Brian, please.
Dr. Anderson. Brian Anderson.
Thank you, Senator Steffen, for yielding your time. Honorable Chairwoman and members of the Public Health and Welfare Committee, my name is Brian Anderson, and I truly appreciate the opportunity to speak before you today. I hope my words will encourage you to support Senate Bill number 6 as introduced. Please go back in time with me for a moment. Acting under authority of Section 2979A of the Political Code, the wearing of masks of approved design will be required. Under this regulation, any person with a cold found going about in public unmasked may be arrested. The greatest publicity should be given to the mask as a preventive measure, and the public encouraged to wear them both generally in and out of doors. Moving picture shows, theaters, churches, and schools should be closed during the period of greatest virulence, as evidenced by the rapid spread of cases, but no saloons were closed. The communications I just read were from October 1918 and were made by Secretary of the California State Board of Health, Medical Doctor W.H. Kellogg, concerning the Spanish flu epidemic. Interestingly, in 1919, Dr. Kellogg authored a study on the control measures adopted during the epidemic. In the study, Dr. Kellogg wrote, "The conclusion is definitely that the mask is ineffective. To absolutely quarantine a town against the rest of the world would be of no value after the first case had appeared in that town." Dr. Kellogg's conclusions have been confirmed by multiple studies. History truly does repeat itself. Other than a few time period specific words, the description of the public health response to the 1918 flu epidemic could also describe the public health response to the COVID-19 pandemic. Just like Dr. Kellogg, our public health officials had no high-quality, statistically significant evidence that masking, quarantining, or lockdowns would work, yet they mandated these ineffective control measures upon the public anyway. The question is why? During Dr. Kellogg's time, public health decisions were driven by fear, but over the years, public health has become political, serving the political ideological interests of academia and big business over that of the individual. Whether influenced by fear or politics, when responding to a health crisis, public health will, by its very nature, always promote a one-size-fits-all approach. That is why it's called public health. Even more concerning is that public health's one-size-fits-all approach is at odds with the Kansas and U.S. constitutions. Public health gives no regard to the constitutionally protected right to the individual liberty because it removes the individual's choice. You can see this reflected in our current public health laws. The Secretary of KDHE has the power to prohibit public gatherings, order quarantines, quarantine the unvaccinated, adopt new rules and regulations, and even order the sheriff to enforce their orders. History has shown us that if given the power, public health officials will continue to implement an agenda based on a political ideology that strips citizens of their constitutionally protected right to individual liberty. Individual liberty must be fortified against such intrusions in the future because they will keep happening otherwise. Public health cannot continue to operate outside the parameters set forth by the Constitution. It is seriously flawed and must be fixed. That is why I am respectfully, please, asking you to ensure SB 6, as introduced, becomes law. Thank you.
Thank you very much. And next we go to Dr. Festus Krebs, MD.
Madam Chair, distinguished committee members, my name is Festus Krebs III, MD, MBA, and I'm a proponent of SB 6. Trust in Kansas public health officials and policies is broken because of the actions of our Secretary of Health and local Kansas health officers during the pandemic. At the October 2021 special hearings on government overreach, 5 days of testimony by Kansans demonstrated boiling anger with school closures, which caused most students to fall 3 to 6 months behind, with forced quarantines, with massive increases in ER visits by teens for mental health issues, and with loss of small businesses and jobs due to shutdown mandates. Then again in 2022 committee hearings and in personal meetings, our secretary and other Kansas public health officials refused to listen to the expert medical advice and testimony given by many physicians, expert in knowledge and experienced in COVID-19 treatment. Despite absolute mountains of high-quality medical studies and data from dozens of countries which proved that the policies of Kansas officials ran contrary to medical evidence, they plowed on with their failed policies. Why did Kansas officials ignore high-quality, experienced medical advice and continue to enforce these ineffective policies that controlled the Kansas populace and made Kansas children suffer horribly? This is uncaring tyranny. The first step to repair trust in public health is to limit the authority of unelected Kansas public health officials to violate patient autonomy and usurp right to personal choice. Doctors and scientists should advise, and Kansas citizens should decide. This is accomplished by SB 6. Thank you, and I'll be around for any questions.
Thank you, Dr. Krebs. Next, we will have former Senator Greg Smith, Special Deputy of Government Affairs for Johnson County Sheriff's Office. Thank you for being with us.
Thank you, Madam Chair. Nice to see you again. Thank you for having us here in the committee. The Johnson County Sheriff's Department supports Senate Bill 6, but our support is focused strictly on page 5, lines 32 to 34 of the bill, which removes law enforcement from the equation of forcibly taking people out of their homes or forcing them to go to certain areas or things like that. Our concern with that is twofold, actually. One, the law that deals with that gives the authority for law enforcement to be ordered to remove someone, KSA 65129B. I put the history of that law in my testimony. This was basically a gut and go that was done on the Senate floor. Turned out to be a budget bill that was gut and goed to turned into all of this that you see in front of you, including those provisions that allow for law enforcement to do that. Our concern is twofold. One, it's not constitutional. We don't have probable cause to take people out of their home. We require probable cause to make any kind of arrest or custodial type of thing. And second, we're just not equipped with the proper equipment to do that kind of thing, particularly if some kind of serious health emergency. We don't have that type of equipment, and I'm happy to stand for questions at the appropriate time.
Thank you very much. Next, we would have from WebEx, Debbie Detmer, a private citizen. Is Debbie on? Dusty? Okay, Debbie, welcome to committee. She's muted. Please unmute yourself.
Hi, can you see me or hear me now?
We can hear you.
Okay, that'll work. I'm Debbie hello, Chairman Gossage and committee members. I appreciate you hearing this bill on Senate Bill 6. I am Debbie Detmer, a retired registered nurse. And first of all, I want to say that I believe in the beginning, everyone was doing their best to address the COVID virus. But it is clear now, looking back, that the mandates were a failure, with great loss to the economics, the children, the family businesses, the working class of Kansas. The shutdowns, the masking, the distancing, the testing, quarantines, and most egregious, the mandatory vaccines to work. To feed your family and to keep a roof over your head, you were mandated to take a not effective and not safe drug. Treatment was available and not shared by our government health system. This bill restricts the power of the Secretary of Health and local health officers from ordering individual isolations, quarantines, lockdowns, and prohibiting public gatherings, or to make unilateral adopt new rules and regulations, and to order law enforcement to enforce these orders. Please pass Senate Bill 6 and restore individual religious and health freedom by returning public health to its original intent, which is to recommend and educate only. Thank you for your time.
Thank you. And next we will have Dr. Jeffrey Earl on WebEx. Dusty, is Jeffrey on?
Yes, thank you.
Okay. Thank you, Dr. Earl.
I would like to support Senate Bill 6 as well. I've been in practice for over 30 years and have witnessed just unprecedented assault on personal and medical freedom during this time. The public health policies that were foisted on practicing physicians were unproven and caused unnecessary fear, stress, and negative psychosocial consequences on the medical profession and on patients. This has caused a significant deterioration in the faith that patients have in their practicing physicians. I endorse an unrestricted freedom that physicians have for making healthcare recommendations to patients, and Senate Bill 6 would accomplish that. Thank you very much.
Thank you, Dr. Earl. And next we will go to Lauren Schiffman on WebEx, a private citizen. Dusty, is Lauren with us? Please unmute your phone or computer, whichever you're on.
Hear me?
Can we turn her up, Dusty? Try again.
Can you hear me?
Yes.
Oh, excellent. So thank you so much, Chairman Gossage and committee members, for allowing me to speak today. My name is Lauren Schiffman. I am out of Lenexa, Kansas. And COVID-19 has really taught us a lot. When it began, I believe that Kansas really did the best that it could with the information that it had. But now it's given us the opportunity to review current laws and statute and explore their strengths, but also identify their areas of improvement. America was brilliantly established as a republic where the people elect representatives to represent them. I am a proponent of this bill because it's simple. It designates that our elected officials are the ones that issue public health orders in an emergency. And with that, I truly believe that this should garner bipartisan support. We always hope that our governors will appoint highly qualified people and subject matter experts of infectious disease to be the KDHE directors and handle pandemics. But unfortunately, history has shown that that's not always the case. For example, in my opinion, Governor Brownback did not appoint a qualified person for this position. The then KDHE director was an ophthalmologist, and where I'm sure they were very smart, infectious disease was just not their specialty. It's an example like this that I would rather that they recommend versus govern. Orders and governing should be reserved to our elected officials closest to the people. It's no different in our local communities. For example, the Board of County Commissioners are the Board of Health, as they should be because they're elected officials. The health department provides these recommendations to that body for them to then decide what is best for the community. This bill just aligns with that statute. So to close, we're not changing.
Lauren, can you hear me? I'm sorry, we're out of time, but we do have your written testimony. Thank you so much.
Thank you very much.
And next, we will go to Dr. Galen Perry.
Thank you for allowing me to testify. I will say that 19 physicians have read my written testimony and say that I speak for them as well. They've given me permission to do that. You know that history speaks loudly of the repercussions of any society when ethical medical practice is usurped by ideology and the power of the state. I will say we are here, and that is not hyperbole. I'm a subspecialist, and people are begging me to be their primary care physician. Because of what they've seen with physicians, healthcare systems, and public health agencies. They've lost confidence. Harmful public policies have been dictated by the World Health Organization, the HHS, and this has been lockstep all the way down to the state and the county. Physicians were using unregulated, non-FDA approved medical products on patients, and countermeasures were used in hospitals where doctors were told they had to use this, and hospitals were incentivized to use that. Doctors literally became the arm of the state. That should keep you up at night. It caused me to resign my job. We have lost faith in our public health policies. And as Kansas physicians, we have been threatened with our license if we spoke out against harmful medical policies or public policies. And our own government has censored Ivy League physicians to actually speak into the public narrative. Kansans deserve protection from orders from unelected public health officials that simply toe the policies of our large public health agencies and create a lockstep environment. Physicians should not fear reprisal for speaking out on behalf of their patients. I would pray that you would support this bill all the way to law. Thank you.
Carol Dantas, Precinct Committee Woman.
Good morning. Thank you so much for allowing me to be with you. Okay, so I'm a precinct committee woman, and I do have an extensive background in the health insurance industry, 24 years of which I worked for Coventry Aetna for 9 years, representative, and also worked with, and licensed with Medicare, worked in a continuing retirement community, which consisted of assisted living, independent living, nursing facilities. I saw exactly what occurred when the 2020 pandemic occurred. I was working at this facility, and with all the, we had a lot of people in the nursing home that were locked down. They were isolated. It was terrible. Just a terrible ordeal. Okay, I want to try to kind of summarize my points. In 1996, all of the licensed agents are bound by HIPAA. So HIPAA is a federal law, as you know, that helps to protect sensitive health information from being disclosed within the patient's consent of knowledge. Also, talk about I like to reference the Nuremberg Code after World War II. We are very familiar with that. It's an international law that we are familiar with that forbids any government, federal, state, or local governments from conducting experiments to individuals without informed consent. So informed consent is the key. And with these vaccines, many did they receive informed consent? Due to the emergency use authorization, because of that, there is no such thing as a one-stop shop when treating patients. And every patient should be treated differently based upon their current health conditions, their medications, their drug interactions. I dealt with all the patients that would come into my office, and I went through all this with them, just with insurance. All right. Anyway, I really do hope that you will go ahead and vote for this. Really, this is not about partisan. It's not about one person. This is about humanity. Thank you.
Carol. Next, we have Nicole Vanicola, Douglas County Precinct 52 Committee Woman.
Hello, thank you for letting us come and speak today. And I'm coming to represent, my precinct, and then also just individual stories of those that actually live these guidelines, these restrictions that are placed upon us. As a mother, I have 3 children, and thankfully I have been blessed with the opportunity to homeschool them, and so I didn't have to have them in schools during the lockdowns and the mask mandates and the social distancing, and there's a reason for that. I am here and didn't have to worry about that as much with my own children until my son had to go and have some medical procedure. And in that time, my son tried to wear a mask and he couldn't. He hyperventilated and almost couldn't breathe. And so I refused to have him wear a mask, and his doctor refused to see him for this medical condition that he needed to be seen. His way of working around that was to say, well, I can meet him in the parking lot and we'll hold up a sheet while he undresses. His doctor, the option that he gave my son was to undress in a parking lot, a 10-year-old boy. And yet, this is the same doctor who, again, I'm sure he was trying to do his best for his patients, for all of the people that he had to take care of. But his best option, instead of letting us walk 5 feet into a door where we wouldn't actually pass by anybody, was to let my son undress in a parking lot. That was the best that he could come up with for not doing any harm, for the oath that he has taken. These are the things that happen to the people when we are made to follow these guidelines instead of giving us the option. And so I strongly urge you to please support SB 6.
Thank you. And next we have Rachel Price, private citizen. Is Rachel in the room? I'm going to move forward to Dr. Jesse Lopez.
Madam Chair and distinguished members of the committee, I'm Dr. Jesse Lopez. I'm a board-certified surgeon of 30 years. I'm a proponent of SB 6. I'm going to speak really fast because I have a lot of data to get through. I'm going to bring to you actual data. As you know, a lot of these quarantines and lockdowns occurred without any data whatsoever, including the rule of distancing 6 feet. Zero data to it whatsoever. COVID lockdowns did not stop the spread of the COVID-19 virus. A huge study published in Nature December of 2022 in Japan that had the strictest lockdowns, some of the strictest lockdowns in the world, closed down bars and restaurants. And guess what they found when they studied this? They found that there was absolutely no reduction in any symptomatology whatsoever throughout Japan. That included respiratory issues, that included sinusitis, fever, et cetera. The only thing that it decreased possibly was cough among college students. I'm going to have this data available for you all so that you can read this firsthand yourself. Secondly, when we look at these draconian measures, we see that lockdowns did not have a significant effect on mortality reduction rate. This is huge. We shut down schools, we shut down churches, we shut down everything except for liquor stores in the name of hopefully reducing mortality. It did not work. This study that came out of Johns Hopkins Institute for Applied Economics of January of 2022, right here, shows, and I quote, overall, our meta-analysis failed to confirm that lockdowns have had a large significant effect on mortality rates. That's number 2. Number 3, and this is probably one of the most significant. Because of the global lockdowns, there was a 25% increase in depression and anxiety that was primarily among our children, especially older children of the high school age. Sadly, my son experienced this and he took his life July of last year. And I will tell you that the depression and the isolation that he faced did not help his mental illness. It took 6 months to be able to get him an appointment because the burden on our health system was so huge from the fear and these draconian measures. It has to stop.
Thank you so much. And now we move to Melissa Campbell. And thank you for making that data available to us.
Good morning, Madam Chair and members of the Public Health and Welfare Committee. I stand in support of SB 6 and urge you to do the same. I think that the bill matters because it cleans up some technicalities on our public health statutes, and that does benefit the freedoms of all of Kansans. Specifically, though, in Chapter 65, 129B, which is on page 5, it also matters because parents have been entrusted by God to raise our kids, and it is my responsibility to make the best decisions concerning my kids and their livelihood as it pertains to their child care and their diet and their education and their clothing and their health care. I do not co-parent with the government. If you do not choose to pass SB 6, the opportunity does exist for abuse to happen. We saw during the COVID situation in China and Canada and Australia that they became police states, and they beat their citizens when they would go out to go shopping for their groceries and take a walk in the park for some fresh air or attend their religious gatherings. Like, this is America. This is Kansas. Like, we say no thank you to that. There's nothing to prevent that happening here except for repealing this statute. So I would urge you to support voting yes on SB 6. You can help be the change to protect liberty and uphold your oath of office. This bill never should have been passed in the first place. It never had a hearing so that we, the people, could weigh in. This egregious power grab should be changed immediately. Please support passing SB 6 out of committee. Thank you, and I'll stand for questions at the appropriate time.
Thank you. Committee, we have about 5 minutes for questions for the proponents, and then we'll move to the verbal opponent testimonies. I will direct you to the 27 others submitted written testimony in support of this bill. Committee, are there questions? Senator Petty.
Thank you. And this is a question directed to Greg Smith. Greg, good to see you here.
You too, Senator.
I know you spoke specifically to the issue on page 5, but my question is, did you or any of the Sheriff Department in Johnson County have to ever do this?
Have what?
Did you, your testimony spoke specifically to the item on page 5 about quarantining. Did you or any other sheriff in Johnson County have to do this?
We did not during this time.
Okay, so do you know of any sheriff's department in the state of Kansas that did?
I don't have any personal knowledge of that.
Thank you. And you also, you were a former state senator, correct?
Correct.
And during your time, did anything get added during conference committees when you were chair?
This wasn't a conference committee that's in my testimony. This was a gut and go on the floor.
It starts in a conference committee. I read it in 2005, but thank you.
Senator Steffen.
Thank you. This is Brian Anderson. If you want to come up, please. Help us understand the difference between public health mandating versus educating and recommending. Help us understand how that works in this bill.
Yeah, so all that is being changed in this bill, right, is essentially what Senator Steffen is saying is currently the ability there is for orders, mandates, and the simplicity is to change things to recommend and educate. And when you do that, as you've heard from all the different testimonies, you give the ability to have that individual choice, which for healthcare freedom, that's extremely important because it not only restricts the individual, it restricts what doctors do, which you've heard from several doctors here today, that it changes the way that doctors practice as well. So by having this simply be recommend and educate, it then gives still that direction, right? And then people can make their choices, they can consult their individual doctors, and things can go on as normal, how healthcare should be delivered and has been delivered for many years. I don't know if that's specifically what you were after.
Thank you. Real quick.
Quick follow-up. Public health appears to have become more political science than medical science. Was that borne out in what we saw back in 1918 and in 2019 and 2020?
It was. 1918 had a lot of fear component to it. This also had a lot of fear. Fear sometimes drives people to do things that they normally wouldn't do otherwise. But yes, political ideology has. I've got 24 years of health administration experience, and I have seen over those 24 years it become a political ideology instead of actually based on, as these doctors here said, the science.
Thank you so much. And we have one quick question from Senator Holster on WebEx.
Thank you, Chair Gossage. First, I just had a clarification question. Was the first person that spoke a doctor? At one point, I think it was said he was, but I wasn't too sure.
That was my fault. I addressed him as doctor and he corrected me.
Okay, well, very good.
He is
That I
not.
just wanted to get that clarification. And then my next question, I'm curious, out of the doctors who spoke, how many are epidemiologists or infectious disease specialists?
I'm not sure who can answer that question.
I'll take that as none unless somebody would spoke up, I guess.
I'd be happy to comment.
All right.
Yeah, you know, through the course of practicing, going to medical school, going to residency, going into specialty, you learn to deal with knowledge. You learn to read studies. You learn to interpret studies. You learn to understand what's true and what's not. And that's not isolated to just epidemiologists in this situation. In fact, they were the ones who peddled the false information more than specialists outside of epidemiology. It was actually the epidemiologists that let us down, that didn't have the wherewithal to deflect to politics and stay with the science. So I don't find that as a worthwhile parameter as to the ability of a trained physician to render their thoughts on this subject whatsoever.
Thank you, Dr. Stephan. And Senator Holscher, I'm sorry, we want to make sure we get to the opponent testimony.
Oh, that's fine. No, thank you.
Okay.
Thank you for that. I don't know if that really answered the question, Dr. Stephan, but I'll assume that nobody in the room is an epidemiologist or
Thank you.
infectious disease. Thank you.
Next, we would have our opponent testimony, and we'll begin with Ashley Goss, who's the Deputy Secretary of KDHE. Ashley, welcome to committee.
Thank you. Good morning, Chairperson Gossage and committee. Ashley Goss, Deputy Secretary, KDHE. You have my testimony, so I'll just go over a few points and happy to answer questions for you when the time comes. One thing I wanted to discuss was Section 2, line 19, which makes it unlawful for any person to violate any provision of this act, which includes giving the Secretary of KDHE authority to take action to prevent the introduction of infectious or contagious diseases. This effectively only allows KDHE to prevent the spread of tuberculosis, which we are currently working, and other infectious diseases such as measles, chickenpox, Ebola, and avian influenza are out of the question with this passage, if this passes. Next, I want to talk just a little bit about Ebola, as Ebola would no longer be able to be tracked by local health departments or the state health department. So if someone potentially is exposed to Ebola in another country and comes to the U.S., CDC notifies the state public health department in the destination state, in which the state public health department then works with the local county health department for where the citizen resides that comes from a country that could have potentially been exposed to Ebola. As you all are aware, Ebola is a rare but highly contagious disease. Local health departments don't receive notification directly from CDC. It does come from the state health department. If this were to go into law, we would no longer be able to do that. In addition, KDHE and local health departments also help patients that are newly diagnosed with sexually infectious diseases, and we help them get into treatment and start the programs that they may need, and also help them to identify their contacts and get them treated as well to stop the spread of that. Section 3, line 35 strikes out teachers and school administrators from the list of mandatory reporters. Striking school administration from the list of mandatory reporters effectively leaves school authorities to make decisions about isolation and quarantine without any health or input or guidance from public health. If they are not informed of the infectious and incubation period, it can result in excessive absences.
Thank you so much.
Yep.
And next we have Dennis Kriesel, who's the Executive Director of the Kansas Association of Local Health Departments. Thank you, Dennis.
Thank you. Good morning, Madam Chair. You have my written comments. We are in opposition to this bill. Again, my name is Dennis Kriesel. I'm with the Association of Local Health Departments. I'm just going to focus in, though, given the need for brevity, on Section 6, specifically subsection B. This is what modifies KSA 65-129B, changing the ability for local health officers to be able to order isolations and quarantines to merely recommend isolations and quarantines. We're very concerned that that could result in uncontrollable disease spread on a host of currently reportable diseases, for example, measles. And we feel that there are already a number of provisions in place that the legislature has installed in order to give people the opportunity to challenge these sort of orders. One is more recent from the pandemic. During special session 2020, House Bill 2016 was passed into law. That modified KSA 65201 and 202, allowing local elected county officials to review, amend, and revoke local health officer orders. So there is elected oversight. Secondly, prior to the pandemic, KSA 65129C does allow, because isolation and quarantine does impact habeas corpus rights, there is a court process that is allowable for people to challenge if they feel they've been unjustly forced into isolation or quarantine. But I would like to remind the committee that there is an assumption that people also have the freedom to be free of disease, going into schools, going out into the public. There are a number of Kansans who have exercised their right for religious and medical exemptions from certain immunizations. Allowing someone to ignore a recommendation, knowing they have measles, to expose others to it, put lives at risk. And so we ask you to oppose this bill. I'll stand for questions whenever you would like. Thank you.
Thank you. And finally, we have Dr. Dina Hubbard, the Public Policy Chair for Kansas Chapter of American Academy of Pediatrics.
Thank you, Madam Chair and members of the committee for the opportunity to be here. My name is Dr. Dina Hubbard. I am a practicing neonatologist, and I take care of babies in the neonatal intensive care unit, but I'm here on behalf of the Kansas chapter of the American Academy of Pediatrics, which represents 450 pediatricians. We oppose Senate Bill 6. The first thing I would like to draw your attention to is the science. This should not be political. I agree with that. It should not be partisan. It is about the science. And while I know you've heard differently today, the majority of practicing physicians do support the public health measures. COVID-19 was a novel virus. Things were not perfect. None of us are perfect. But we were doing the best we could based on the science. And there were unintended consequences. But again, we were trying to protect everyone as much as possible. This is not an individual situation. Public health affects us all. Similar to drunk driving, do we want people just recommending that you don't drive drunk? No, there need to be authority and consequences. The misinformation and disinformation is what undermine public health and physicians in healthcare. A statute like this would not allow a timely response to the next novel virus or infectious issue. There's not time for the legislature to act in things like that. So you have to trust the people that have the expertise. Thinking of the Chiefs game, which we're all recovering from, would we want a concession staff member to tell Mahomes to go back out on the field or not go back out on the field? No, doesn't have the expertise for that. We want an announcer telling Andy Reid what plays to run. No. Some of the unintended consequences of this bill affect public health, foodborne illnesses, salmonella at restaurants, agriculture contamination, not wearing shoes in a restaurant. These are things that are under public health that need to be supported by the science. Thank you.
Thank you so much. Committee, I would address your attention to the 21 submitted opponents in written testimony and the one neutral opponent, and we have about 3 minutes for questions. Dr. Steffen.
Thank you very much. And this is for all of y'all. It is important that we all notice that we've got government agencies here. We've got lobbyists testifying as opponents to this bill. That's very important. It's not the people. It's the government. It's paid lobbyists. From there, let's talk about credibility. Y'all talk about this need to be able to prevent the spread of disease. You didn't do it. You can't do it. Help me understand what part of this COVID response that your mandates, your quarantines, that any of it made a difference. You can't show, you knew beforehand that it wouldn't work. You made it up as you went. You had no science. You have no science now. If I'm incorrect, please stand up and show me your scientific studies that show me, that can prove to me that anything you did worked. That's why we want to put you to recommend and educate. That will bring earnestness to your efforts. Your hubris is astounding today. To stand up here and pretend that you all did anything that was effective during that COVID response is ludicrous. But bring the studies if you got them. If you don't, recognize your inadequacy in the field of public health. Recognize it, admit it, regain our trust. Now you don't have it, and you certainly didn't gain it today. Thank you.
Thank you, Dr. Stefan. And we have Senator, I'm sorry, we don't allow that in committee. And let's have Senator O'Shea have the last word.
Oh, thank you, Madam Chair. A question for Dennis. Or can I ask a question? Okay, thank you. Can you share a little bit more? I know that there have been outbreaks of measles or meningitis or whooping cough in different parts. I know it's specifically with childcare centers, it's a big risk. Can you tell me a little bit more about how that's been handled in the past in the state?
I'm not the expert on that, so KDHE might be able to provide you a bit more information, but normally what will happen, to the best of my knowledge, is all of these diseases are vaccine preventable. So if people are vaccinated, they'll often be allowed to continue, if they're fully vaccinated, be allowed to continue in the particular setting where the outbreak is. If they're not, there may be a recommendation for them to stay home. Quarantine would only happen, though, if there's a significant risk of exposure, and each of those is different by each disease because different diseases spread differently. Those are defined by KDHE in something that they commonly call the DIG, or the Disease Investigation Guidelines, and that would provide the guidance for when you would turn to mandatory quarantine. A lot of times quarantine and even isolation currently is only done on recommendation anyway. Sometimes mandates are used if people are going to say something like, well, I know I'm sick, but I don't care. I want to go out and shop at Walmart, and that level of disrespect to their fellow community members has sometimes resulted in mandates.
Thank you very much. And committee, I would first like to thank Danola for putting all of this information together. It's hard to coordinate that, and I will allow that applause. We have to vacate this room. Committee, we are adjourned.